She's been a frequent guest with us since the beginning of the pandemic, a disease doctor, an epidemiologist. We are talking about Cherise Rohr-Allegrini. She joins us now. Cherise, thank you for joining us. I want to talk about COVID right off the top. I mean, it seems as if we're having high numbers of people that are coming down with COVID. Are we correct to say it's more transmissible but not as severe?
That's correct. We're definitely seeing more cases than we've seen in a while. We were very hopeful in late March through April. Numbers were down. May, they started to increase. And we're at levels that we didn't see since late February. So that's concerning. Our hospitalizations are increasing, and that's our way to judge for severity. I'm still fairly low and still okay, but that is concerning.
Talk to me about the reinfection rate of those who have the booster shot or maybe are overdue for another booster shot.
Right. So the recommendation is to definitely have your 3 doses. Now, if you are at higher risk, the recommendation is for 4. They're certainly encouraging people to get that 4th. And that's not unusual for any vaccine. There's a lot of vaccines where you need 4 or 5 doses to be immune. And we do see that reinfection happens, but the severity is much lower. Transmissibility is much lower the more doses of vaccine that you have.
Do you think it's because we still don't have a lot of people that are getting the shots that they should get? Is that what's driving this latest surge, you believe?
That's part of it. So our vaccination levels haven't changed much more than about 1% in the last 2 months. And that's for most age groups. So that's really concerning. We have a good rate of vaccination at about 68 to 75%, depending on your age group. But we really need to get upwards of 80, and that's concerning. And I did quickly look at the announcement today about the new vaccine, and that's very, very promising. It's not available yet, but it is very promising. But really, if we get enough people vaccinated, we'll have less virus going around, less transmissibility, and we'll be in better shape.
Talking about that new vaccine and as well what we're about to face in the fall, we're talking about potentially having a next generation vaccine, so a new type of vaccination in the fall from Moderna. But also we need to think about the flu shot as well. How many shots are we going to be recommending in the fall?
So definitely another dose of the COVID, I'm sure, especially if we get the new vaccine, is going to be likely. And we always recommend the flu shot in the fall. The last 2 years, flu has been very low. This year, flu has really peaked in May, which is about 3 or 4 months later than normal. And I really think that has to do with us taking precautions for those 2 years during what would be the peak of flu season, and then relaxing those in the last couple of months. So definitely we're going to need to get a flu shot. We will probably need to get another COVID booster, which means that those folks that haven't gotten their shots yet, we really need to get them up to date.
So we're still seeing flu cases right now. Is that what you're telling us?
Absolutely. So May had a surprising number of flu cases in San Antonio and across the country. Normally, flu will peak December, January. We'll see some into February, and it really starts to drop by March. Seeing flu cases in April and May is generally rare, but we're seeing a lot. It's definitely not as much as we would normally see in the winter, but definitely much higher than we normally see this time of year. And it's not that there's anything spectacularly different about the flu that's circulating. It's mostly that I think we were taking so many precautions up until recently that kept the flu at bay. And now that we've relaxed those precautions, flu is having a chance to spread.
Is there a possibility that they're going to move up the time that they're going to want us to take a new flu vaccine?
Well, typically it gets released in August, and we push it August through November. That's the ideal time because that's when flu season occurs. I'm not sure yet if they're going to want to do it even earlier than that. I think what we do is we really look at what's circulating in the Southern Hemisphere right now to do any tweaks that we need to do. But what we have planned for the fall for flu is what we're expecting, because again, our precautions that we've been taking, I think we're less likely to take this fall, which means we're going to have flu season at the normal time, November, December, which is concerning if COVID is still pretty significant.
I want to switch gears and talk about monkeypox right now. A lot of media stories have been done about it, about the concerns that are out there. What do we know about it right now, and how concerned should people be about it?
Well, it's always a concern, but to date, there's only been 35 cases in the U.S. Now, that's way more than normal, so definitely it's a concern, but it's not highly transmissible. You need to be in very close contact. It is in droplets, so it can be in your saliva and what you breathe, but the droplets are quite big and heavy, so they don't travel far. The other way it gets transmitted is skin-to-skin contact, and that's more likely. So having contact with the sores is problematic, and most of us are not in that situation. So I don't think the average person needs to be concerned too much, other than keeping an eye out for it. But it's not going to spread like COVID or even flu or some of those other respiratory viruses.
I think there was a little bit of confusion because I believe it was yesterday or the day before the CDC came out and recommended that travelers use masks because of monkeypox. Then they took it off the website and kind of put it back on a few hours later. So there's a little bit of confusion as to that airborne issue.
It is in droplets. It's in saliva. It'll come out of your mouth. So yeah, masks will certainly help you, especially if you're in a crowded space, being in close contact with others. And on a plane, you're in a crowded space. I was just on a plane and we were packed in like sardines. So that is definitely an issue, but it's not like it's traveling through the air. There's skin-to-skin contact, there is respiratory, but it's not traveling like COVID is or some of the other things that we're more used to. I still recommend wearing a mask when traveling because of COVID, because of flu, because of a number of other things that are in the air.
Great advice. Mask up.
Yes.
Cherise Rohr-Allegrini, epidemiologist with the San Antonio AIDS Foundation. Always appreciate your time, Cherise. Thank you.
Thank you so much for having me. Thank you.